Thank you very much, David. Very informative. We've had lots of chat, lots of questions on the chat box. So I'll just read out some of the pertinent ones. David Juggins did ask, he was interested to understand which types of technology, what information in an emergency setting 5G will benefit, or what we're targeting going forward. So I know we've got Leslie Holt on the call as well, and Sally, so that's something to think about. Natasha's raised a question about using 5G around education and learning. It's a good question. And I think David did mention that this has been done in Staffordshire as well. And any of the direct questions I'll pick out now. One around the connected ambulances trial and what's happening with that next. So Sally or Leslie, are you able to respond to that question about the connected ambulance trial? Waiting for them to mute. Thank you, Leslie.
Apologies, sorry, I was struggling with my technology, which is not a good sign, is it, when that's a related question. I'm not sure I'm best to answer from a technology perspective, because I'm head of communications and stakeholder engagement for West Midlands 5G. So anything relating to that, I can be super helpful, but technology, I can't be. The only thing I can say is, you know, what I know is the 3 trials we've done already, and we're super keen to work with trialists in other areas. We don't endorse technologies. We are looking for SMEs, products, or ideas and innovations that we can take forward to test and trial. And Sally can probably talk a little bit about what she already has about what we're doing, but ambitions for the future. The other related answer, I think is really relevant, and particularly for smaller organisations, is to be aware that we actually have innovation hubs across the region in Coventry, Wolverhampton and Birmingham physically now. I'm pleased to say we have been running, as Ravi will well know, we've been running virtual events up till now. So in the new year we'll be actually having physical events of different types, but it's a route for SMEs with ideas, with products, solutions that they want to test and evolve, to come along and actually have a private 5G network and the expertise around them. So not just the technology, but the business expertise, the access to funding, lots of different information that an SME or a startup would need to know. So not directly answering your question, but that's what I can give you. And I don't know if Sally would like to add to that one.
Yes, I'm going to probably pick up on your final point there, Leslie, but I'm not going to directly answer the question either, but but just to give you a flavour of the sorts of things that are going on and building on Leslie's observations, really. So there have been a number of early sort of shaping and trials of things across the country. So we've been involved in some trials over in the east of England and in the in the south, and trying to and working with our colleagues at the Catapult around building the living lab, which is still very much in progress, and we're looking to get some wider funding, hopefully through the European Space Agency, to really sort of progress further with that development. And the idea, basically, as we said very early on in the session that Adrian alluded to, was actually about enhancing the ability to sort of to see and treat, and how 5G enables that. And so there's a combination of actually testing that out with real life vehicles, but also doing simulation sessions in the living lab about the art of the possible. And the sorts of things that we've been working through is looking at specific high volume pathways and trying to think about how we could simulate what the difference could be in a sort of a see and treat mode for ambulance. And if I just share one example that we've been sort of like working through, is one of which is stroke, which often presents itself as a multiple of different sort of presentations by the time people get conveyed to hospital. But what we're trying to work through is what would make the difference to enable sort of like a more immediate response on site in terms of the technology, and enabling people to have really high quality images being sort of like sent from ambulance to a clinician, and equally being being able to ensure to have a clinician that might be dedicated to responding not just in necessarily a region, but across a much larger area to specific and presentations that might align to stroke, so that actually the consultant might not necessarily be in the West Midlands, for example. They could be in Scotland or anywhere and be stroke expert, because the technology will enable that to happen. So looking at different ways of intervening there. So that might feel a little bit radical on our regional, the way that we operate on a very regional basis and very hospital based, but those are the sorts of things that we're trying to explore. You know, what does the technology offer that actually makes us think of the art of the possible, than rather than digitizing the day job, I think really is where we're trying to get to. So yeah, sort of really trying to pick things like that. And interestingly, I noticed earlier in the chat there was an observation about fire service colleagues interested in exploring some things there. We'd certainly be happy to connect with that, because obviously some of the colleagues that we're working with are not health service specific, but actually work with wider sort of blue light technology, and so we're used to sort of working with sort of adapted vehicles like that. So happy to pick up and connect accordingly. So that's where we're at, really.
Thank you, Sally. We've had a couple of questions about the cluster, but what I want to do now is open it up to the floor. If anybody has any follow-up questions around 5G or for Sally that they'd like to ask her directly. So Natasha, I think you asked about what images are being shared by health staff in the trials.
Yeah, apologies again that I'm whispering, but yeah, I'm sitting in a car showroom, so forgive me. Sally, could you just clarify? So my background is in paramedicine, so and we've been dipping our toe in the water with connected ambulance. When you said, oh, well, 5G connectivity will allow for high-res images. One of the stumbling blocks that we've hit is, you know, images of what? You know, when we're not talking intracerebral images, we're talking, I'm assuming, images of the patient's appearance.
Yeah, I mean, one of the things we've been trying is actually almost sort of is having really high quality cameras, a bit like I mean, the Techie Health demo that we showed you was very sort of, you know, the resolution with some of the technology there in terms of being able to have a really good quality down your throat, in your ear. So it's, but also one of the things that we felt that that clinicians have been saying is that often very physical appearance is quite indicative of people's well-being. So the combination of asking the right questions, being able to sort of like take sort of more specific images, and actually sort of enable very much almost feeling like you're in the van, in the ambulance, being able to see somebody, because sometimes some of those so that's what we see, is that's the additional level of quality.
So can I give it a very, I'm sorry, Ravi, can I give a very short question or challenge to that?
Absolutely, I'll take that back. I might not be able to answer you, Natasha.
So it's more about, obviously, physician-led services rather than paramedic-led services. One of the issues we have is that we don't have a physician-led service in the UK. We have very much paramedic-led service, and that actually we need to be incredibly sure that what we're doing doesn't sort of alienate or push aside, you know, just like by calling it a van, is saying that you know, our extremely well qualified paramedics, advanced paramedics, who, you know, we train for 4 or 5 years with advanced degrees, are not capable of you know, assessing a patient's visage. This is what I'm saying about photos, in that that's perhaps less of a challenge than maybe some you know, cardiac ultrasound that does need specialist help. So it's more of a challenge than a question. I just wanted to get that across to the group.
Yeah,
Natasha, I don't know if that links with the trial that we undertook at University Hospital Birmingham in July last year, because that was the ultrasound scan. Yeah.
Thank you for that, Natasha. Any more questions for Sally or 5G related?
I noticed there was something on the, I think it was Paddy asked the question, I'm not sure now on the chat, I closed it, about 5G coverage in the region. And yeah, I mean, there's a level of realism in Adrian's slides. He showed, which is great, that we are the most connected region in the UK, and I've forgotten what the percentages are, but the reality is we are the most connected, absolutely, but we're still got a long way to go. I think, I can't remember what the figure is, but it's something like 12% of coverage in Birmingham, which is the biggest urban area. So that is great that we're ahead, but we've got a long way to go. So part of our work isn't just on the use cases. We also have an infrastructure acceleration team who work extremely closely with all the local authorities and all the MNOs in the region to, quite frankly, in the simplest form, make the West Midlands a very attractive place for the MNOs to come to. And like I said, we've obviously achieved that in some part by making us the most connected region, but that work has not stopped, because we've got still quite a long way to go to get more and more coverage, not just in the Birmingham city centre, and we've got good coverage in other areas like Coventry and Wolverhampton, I must add, but we need to actually make those figures go up so that actually the use cases can be placed on top of it across the whole region. So not answering the question, but it is part of our work and it is ongoing.
It is, and if I can add to that, there's a lot of focus on infrastructure at the moment, especially fibre, and ultimately 5G is a fibre product because it relies on the fibre backhaulage. And as Sarah Windrum and Ian Mansell know, there's a massive focus on that at the moment to roll that out. Sarah, you asked a question around linking in with other universities, what they're already doing. For example, Warwick have just established the Institute of Digital Healthcare and how that links in with the cluster. So a question for David there in terms of existing activity and how it links in with what we're doing.
Yeah, and I noticed in the chat that Sarah claims the credit for being the person who challenged me on internationalism. So thank you, Sarah, for that. So, I mean, there is a great diversity of support for health technology businesses in the region already, and that exists. And as I say, that common criticism I get is about people and businesses that fall between the cracks between different ones, or duplication where the same people are doing the same thing in different places. And if only they knew about it, they could kind of make some savings by collaborating better. And when I said that one of the services from the cluster is signposting, it's pretty obvious that for us to sell that as a service, our surveillance and intelligence would have to be spot on for us to know that they all exist. And that's kind of the first point I want to make. And then there's two more points I'd like to make, which actually come from a workshop that we did in the region with the Department of International Trade. And the first was those answers another question in the chat about what kind of technologies are we talking about that are in scope. And I'm saying it's any technologies that would support services in healthcare, social care, and public health. And in that workshop, we identified that our kind of top strengths in the West Midlands are diagnosis, digital, and devices, and all underpinned by access to data. And so I would say that that's very much the kind of areas that are in scope. And the second one is about all these different services that do exist at the present time. We talked about something that we might call a concierge service at that workshop, which means that somebody actually knows where all these other support services are and can put people in touch with the right one and can keep involved until we know whether the person with the query, problem, exciting idea has got a satisfactory response to what they wanted to put forward after we've put them in touch. So somebody who keeps hold of their hand until they've reached the end of their journey. And so that concierge service, I think, would be something that the cluster could organise and join up with other organisations who already do it and make it one whole. And so that's my answer to that question in terms of what we'd do about the existing services that are already there. We would embrace them, not try to replace them.
A perfect example. Sorry, Sarah.
Yeah, can I, you know me, I always like to have a comeback. And I guess also perhaps involve them in the strategic kind of vision for the cluster and where that's going. Because I think we talked quite a lot about joining messaging up. So I think having that kind of overarching, kind of messaging that then gets distributed through all the partners. So everyone is kind of saying the same thing and has got the same kind of messaging for the West Midlands, I think is really important. And the other thing I would just add is the reason, I mean, this isn't a world I'm overly familiar with, I'll be brutally honest. I understand, operational IT and fibre, as Ravi said, not necessarily health or health technologies at all. But the reason the Commentary and Warwickshire Left is particularly interested in this is we've had quite a significant amount of VC investment come into our businesses in this sort of space. And that was something we didn't realise until we did some research on that, because obviously it's not something that's immediately kind of obvious to a local enterprise partnership. So I think don't forget that there is that kind of VC business angel investment network going on that is particularly interested, and maybe it picked up on something before we knew it, but seems to be particularly interested in the West Midlands in that health technology space.
I mean, I totally agree with you that I think we're an attractive proposition and at the right time in history. And I think that's really is important. And that's what I believe makes for the opportunity for the cluster to be successful. Just on your first point, we will have, of course, a communications plan for all that communications and advocacy that members would want to see. But more than that, we'd have a very detailed engagement plan for how we engage with our members to make sure they feel that they're in control and they're making decisions for us, but also with the people we've got to work with to make sure that we've got our lines straight with them and that we all identify the common problems and address them together.
Perfect. And Sarah, I think it'd be really interesting to explore that VC research you've done as well to see the opportunities that exist. We've got a couple of minutes left, and I'd certainly welcome questions from any members who haven't spoken yet and who are on the call and have got any questions they'd like to raise. Feel free to raise them. I was going to endorse one of the points that David made as well. A perfect example of collective collaboration is the 5G project. So Sarah was, along myself, was on the original planning committee when we submitted the bid into DCMS, and the region won it. So it's an example of what we can do certainly in this space if we come together in terms of health technology. So in the text, there was a final question around bringing together, understanding what the overall plan is, by David Juggins, and I think David's responded to that because David will be putting a business plan together, which will be available in the new year, which will be circulated once that's done. Final questions before I hand over to Sally to close. No, Sally, to yourself, if you can bring the meeting to a close, please.
Yeah, no problems at all. So I'd just like to thank everybody for taking part. I think it's been a really, really useful session. Small but valuable number of participants dropping off quickly here by the looks of it. So I'm not, we've only been on for an hour, and I hope what we tried to bring together is a little sense of the art of the possible, things that are already happening around there in 5G and healthcare technology, which hopefully bring it to life, but also spark people's interest and curiosity, and again flag areas for collaboration, but more importantly how they dovetail into the development of the West Midlands Health Technologies Cluster, which will obviously be a really, really key sort of conduit for bringing all that together and actually bringing sort of both the technologies and how we build and spread those, and 5G is obviously an absolute conduit for all of this. And as we move into a sort of I would like to say post-COVID world, but and after tomorrow perhaps we're starting down that route, but only time will tell. But COVID has sparked an acceleration of digitization and how we do things and think things and engage differently. And I think what we need to do is to sort of make sure that we maintain and build on the really excellent examples of that, and rethink some of the other things and exploit the technology at our disposal, because whatever the new norm looks like, it won't be where we were before, because we've all come too far down that technology road. So I've run over by a minute. So thank everybody very much for giving up your time and for coming, and hope you've all found it really useful.